It's Friday. The Doctor's In Live with TOA is back. I'm Gray Stallman. I'm your host. Thanks for being here. Casey, Addie are here with us. I'm by myself, so you get my smiling face. But thank you for being here. As always, I appreciate your interest. I appreciate your comments. I appreciate any ideas that you might have for future shows. We do this for you. I want this to be interesting. I want it to be fun. I want it to be entertaining, but informative as well. So let us know. Comment down below. Little comment line, little arrow thing says comment about what you'd like to see. Carlos, if you're here, happy 4th of July, man. I hope you had a good one. So today, we're going to talk a little bit about, it's going to be applicable mostly to spine, but also to orthopedic surgery in general. We'll talk about things, but I wanted to talk a little bit about complications, risks of surgery. When people are deciding whether or not they want to have surgery for a bone and joint problem, it's always important to understand what can happen to you if we do surgery. Because not everything good happens. And it doesn't mean that people have done anything wrong, but bad things can happen. And so we need to talk a little bit about that so you can be more informed. I've always felt that it's important for people to understand and ask questions about what they're up against. Because 99% of what we do, what I do in spine, what other guys do in orthopedics, is not life-threatening problems. You're not going to die from the problem you have. I've always joked, and it's kind of a cruel joke, but nobody's died from arthritis. So if you're having a skeletal surgery, it's called elective surgery, which means you've chosen to have it done to try to help improve your life. But the problem that we're trying to address is not something that's going to harm you. It's not going to kill you. It's not going to shorten your life in most cases. And so it's a choice. And when you have a choice, you have the important need to understand both what the surgery can do for you, but also what can potentially go wrong. Okay? Now this is applicable to any surgery of any kind, but we're really going to concentrate on musculoskeletal and primarily spine because there's some special things in spine that don't apply to orthopedics in general. Okay, so but before we get started though, remember TOA is Tennessee Orthopedic Alliance is the largest, biggest, most widespread orthopedic musculoskeletal practice in the state of Tennessee. We service southern Kentucky, northern Alabama, all the way out to Knoxville, all the way out to Columbia. We're here for your musculoskeletal needs. So if you have aches and pains, something broken, something out of place, pinched nerve, that kind of thing, let us hear from you. Go to TOA.com. You can learn about our practice, our locations, our physicians, our services. If you want to go back and have a little bit of a nostalgia, we were just talking about My Favorite Martian and Fast Times at Ridgemont High. Those are things I grew up with. A little nostalgia fest. You can go to our media center and you can see every single one of these episodes that I've done. Unbelievable. Anyway, TOA.com. If we can help you, we want to be able to help you. Okay, so let's talk a little bit about complications. And basically, think of it this way. If you have surgery, the only way to avoid a complication or a risk with surgery is to not have surgery. Okay? Every single procedure, simple to complicated, has potential for causing a problem. Now, the most general things associated with surgery are the biggies. So, infection, bleeding, trauma or damage to the structures around the area where surgery is happening, wound healing problems, failure to achieve the goals that we were trying to achieve. Those are kind of universal, okay? So infection, we do everything possible to try to reduce or eliminate the chance of infection. It will never be zero chance, unless you don't have surgery. But we can minimize the chance of infection by using special sterile technique in the operating room, giving people antibiotics before, during, and possibly after surgery, treating the tissues well to minimize the trauma to the tissues, being very careful. Hopefully we can reduce the infection rates to below 1%. Many outpatient surgery procedures, shoulder scopes, knee scopes, hand surgeries, the infection rates are less than 0.5% or less. With bigger operations, using implants, we've talked about joint replacements in the past, we've talked about spine surgeries in the past. Those are bigger operations, more trauma to the body. We hope to get the infection rates down to somewhere between 1 to 2%, maybe less. Now, even with everything done right, somebody can still have an infection because those percentage numbers are strictly averages. So there are some people who have infections, some people who don't have infections. You blend the numbers together and it becomes an average. So we can never make that risk zero, but we try to do everything we can to minimize the chance of infection. There are some things that your body has an influence on that increases the chance of infection with any kind of musculoskeletal surgery. Diabetes, previous histories of wound infections, ongoing active infections in other parts of the body, obesity, some what we call immune system state dysfunction, so poor immune system. So if you have active cancer, you're undergoing chemotherapy, you're taking medications like steroids that decrease our immune systems, all those increase the chance of infection. Some of those are in our control, some of them are not. Okay, so that's universal with all surgeries. Bleeding, anytime you cut through the skin, your body bleeds. Most of the time, we're not near big blood vessels that can bleed a lot. Usually it's a cut in the skin and it's some oozing. But in spine, in joint replacement, in some of the bigger operations around the center portion of the body, there are bigger blood vessels that can be injured. And if you cut into a blood vessel, a vein or an artery, a lot of blood can come out. The way we minimize the chance of bleeding, and really bleeding most of the time is well tolerated by the body. If you bleed a lot, you can get anemic, which means your blood counts are low and your body can't circulate oxygen well. And in some cases, patients need blood transfusions to build up that oxygen carrying capacity. What we want to try to avoid is giving somebody a transfusion, because there are risks to a transfusion. It's not just simply putting his blood into me because there's a risk of infection or disease transmission or a reaction to that. It's also very expensive and a limited quantity or supply. So we try to avoid transfusions. So the main way we avoid big vessel bleeding is be careful in the operating room. We do everything we can to know where the blood vessels are and try to avoid harming them. It can happen, but it's not very common. It's far less than 0.5% of major bleeding requiring something like transfusion in the vast majority of cases. So that's a pretty easy one to talk about. We don't worry too much about it because it's such a small problem. Damage to the surrounding structures can happen in any musculoskeletal case. In the spine, there are some additional things that are a problem, but structures like the spinal cord, like the ligaments, tendons, muscles, blood vessels, nerves that are around joints. We're using saws, we're using knives, we're using hammers and screws and nails. It's possible to harm one of those structures. And if that happens, it may not be repairable. Sometimes it is, sometimes it's not. And that can lead to a variety of problems. It can lead to an increased chance of infection. It can lead to problems with lack of function. It can lead to instability. again, we do everything we can to try to minimize that chance, and we're careful as best as we can in the operating room. We try to do smart, careful work with our sharp tools, but occasionally it can occur. In the spine, this is really important because I'm operating right around the nerves and the spinal cord. If I slip and cut a nerve, or if something happens and the spinal cord gets smashed or squashed, I can cause permanent neurologic damage to somebody. So I can cause somebody to be weak or have permanent numbness or tingling. I can cause people to be paralyzed. Those are super scary moments when they occur, and they do occur. Things slip, things change. You grab onto something you didn't intend to. It doesn't happen often. We do everything we can to minimize that chance happening. And frankly, nerve damage, spinal cord injury in spine surgery is very, very rare, but it can happen. And so if you're dealing with something that is a painful problem, yes, that's uncomfortable, it's a nuisance, whatnot, but there is a risk of nerve damage and paralysis. You have to weigh that when you're making a decision about surgery on the spine. Now, it's important for the surgeon to really help the patient understand how likely that can occur. Just because it can occur doesn't mean it occurs often. And in fact, these types of complications that are catastrophic complications are extraordinarily rare. But if they happen to you, your chance of it happening is 100%, and that's not good. So people need to understand that while we do everything we can to minimize the chance of nerve damage and paralysis in spine surgery, it can happen, but it's a balance of risk and benefit. How comfortable are you with a very low likelihood of happening with a very high likelihood of a good outcome? And everybody's different. Everybody has to make their own decision about how comfortable they are with those numbers as they go up and down. I mean, people go to Vegas all the time. They go gamble, okay? It's the same thing. It's risk-benefit. I'm willing to throw away X number of dollars with the hope that I can pull back Y number of dollars, okay? Some people are more comfortable throwing their money on the table than others. That's why there's $5 slots and there's $50 slots or tables or $5,000 poker tables. I mean, because everybody has their own level of comfort with risk. The last thing in general with any kind of surgery is failure to meet the hopes and expectations of the outcome. So what I mean by that is we hope to get this improvement or this repair or this healing happening with the surgery that we do. Sometimes we don't get to that level and we get to some lesser level. So people have to understand, and this is very common in spine. When we're dealing with spine and nerves, there's a lot of unknowns that we don't have any control over. What we're trying to do is take your current spine and not make you a new spine, because we don't have a spine replacement, but we're trying to make you a different spine to help address the symptoms that you're currently having. There are limits to how much surgery can help that. So for example, I'll tell people in this particular operation, I hope to get 80 to 90% improvement in your leg pain. But I can only hope to get about 50 to 60% improvement in your back pain. If people understand that and they understand the limits of my surgery, we can have a good outcome, because 50% is better than no percent. But the problem comes, in my experience in spine, when a lot of surgeons will say, they try to make people feel comfortable, don't worry, you'll be as good as new. We're going to get you back to the better than you were. And the human mind says, our brains kind of hear that and say, oh great, I'm going to be normal. And even if they have a perfect outcome with regard to how much the surgery can actually accomplish, they're disappointed because their expectation of, I'm going to be normal, I'm going to be pain-free, wasn't met. even though everything else went perfectly. And so it's really important for the surgeon and the patient to understand one another with regard to realistic expectations. When Dr. Willis, who we've had on the show, does a rotator cuff repair, he's taking something that's damaged and trying to repair it. Now, he doesn't make it back to the way God gave it to him, but we're lucky enough that we can do things and fix things that are pretty good. They're not perfect. And so nobody can expect to be perfect when we're trying to do orthopedic musculoskeletal surgery, because we're still dealing with a structure that was damaged and is trying to repair. Our bodies, unfortunately, don't get better than they used to be. What we're trying to do is get you as close as we can to where you want to be. Okay? So now we're going to talk a little bit about spine specifically, and there's two areas in the body, the lower back and the neck, that are the most common areas in spine where we do surgery, and they have a different set of potential risks or complications. So we've got infection, bleeding, structural damage in general, failure to meet expectations. In the neck, if we're doing a surgery in the front to remove the disc and help people with a pinched nerve down their arm, the structures in the neck, there's tons of structures in the neck that can be damaged. The swallowing tube, called the esophagus. The breathing tube, called the trachea. Nerves that run your vocal cords, called the recurrent laryngeal nerve. Big long word. The sac that holds the spinal fluid around the spinal cord, that's called the dura. The spinal cord itself, there's a group of nerves called the sympathetic nerves that help run kind of your primitive system in your body. And if we damage any of these things, we can cause problems. So if I damage the recurrent laryngeal nerve that runs your vocal cords, I can make you permanently hoarse or a wispy voice. If I damage the sympathetic nerves, I can cause you to have a droopy eyelid or a dilated pupil on one side, or a little bit of lack of sweating on one side of your face. That's kind of weird. If I damage the spinal cord, I can paralyze you either completely or partially. The swallowing tube and the breathing tube, if I punch a hole in one of those things, that can oftentimes lead to big time, major, bad, sometimes deadly infections. So there's lots of things that we are working around. We do everything we can to try to minimize harming them, but we have to understand that it's possible, even in the best of circumstances, to harm these things. Your job, as part of being the patient, is to ask the questions, understand how likely, what's your experience in this, doctor? Have you had problems with people who've had paralysis or partial spinal injury or recurrent laryngeal nerve injury leading to permanent hoarseness? Have you had those? I've never had anybody paralyzed. I've never had anybody spinal cord damage. I have had a couple of patients in 25 years develop permanent hoarseness. I've had one person develop the Horner syndrome, the droopy eyelid. I've never injured the esophagus or trachea. I'm not here tooting my own horn. I'm just being honest. What that really should tell you is, in the thousands of these operations that I've done, I've had a handful of complications. That really goes to tell us that the safety of these operations is actually really high. The likelihood of something bad happening is really low. And so that should help give you some confidence. In the lower back, there's a different set of structures that can be damaged. If we're operating on you from the back, basically we lay you on your belly and we operate from the back, essentially towards your belly, okay? If I were to pass an instrument through the disc, through the spine, into your belly, I could damage the intestines or the big blood vessels that run down your legs, the kidneys, the tubes that empty your kidneys to your bladder, which are called ureters. I could damage any of those things. And if I don't recognize that damage, you can have an injury to that and bleed inside without us knowing it until it gets too late. There have been good surgeons in this town who that has happened to, and patients have died. Does that mean they did something wrong, terrible, bad that they meant to do? No, it was an accident. but it can happen. How do we minimize that chance? Number one, we're super careful about it. I'm super careful about it. My colleagues in TOA are really paranoid about having complications. There's nothing worse than having a complication occur. Secondly, we know our stuff. We know our anatomy. We know where the areas that are safe, where it's not safe, and we're just very careful. And three, a good surgeon takes his time, his or her time, and lets people understand what they are up against. So before surgery happens, my job is to help you understand what things could potentially go wrong. I've had patients who have said, oh, I don't want to hear this. Don't tell me this. Just let's go ahead and do surgery. And it's my practice, it's my philosophy that if somebody doesn't want to hear about the potential for risk, I'm not going to be your doctor. Because when we go into the operating room, we do it as a team. We have to understand one another that bad things can happen, even if everything's done right. And it's unwise to go in blindly. I don't think any patient who doesn't want to hear about complications is ready to have an operation. Now that's my opinion, and I know it's scary, but we have to understand what we're up against to make a rational decision. And so I think it's the patient's responsibility to ask questions and understand. It's the surgeon's responsibility to lay out what can potentially go wrong. Now, it's a little crazy to expect a surgeon to lay out every single possible complication known to man, because you'd be there for days in the office talking about it. But what we tend to talk about is the major ones that can occur, the major ones that are particularly of interest to that particular surgery, and then the really catastrophic things, the stuff that's super rare but really bad, like damaging the spinal cord, or bleeding because you've damaged one of the big blood vessels, or dying, okay? So, like it or not, you need to hear it. You need to understand what you're up against. And that's with anything, okay? You get Botox injections for wrinkles, there are potential for risks to Botox. It's not just all rainbows and unicorns, okay? You take aspirin for a headache over the counter, people don't think that's medicine and they're at risk. There's actually a lot of risk to aspirin. It's a great medicine, but there's a lot of risk to it. You have to understand that there's nothing that's perfectly safe. And in surgery, the only way to avoid a complication or risk with surgery is to not have surgery, okay? I don't do this to scare you. I do this to inform you. I think it's really important to understand that, again, with techniques, education, practice, and technologies, we have the ability to really make surgeries very safe and very low risk. We don't have the ability to make it risk-free. And as long as you and I, the patient and myself, understand this and come to an agreement with it, then things generally work out well. And if something happens, whether something gets damaged or whether there's a bad outcome, my promise to you and the people of TOA's promise is we're going to stick with you and work through it as best we can. We're not just going to walk away from you. That's not good medicine. So when you and I come into an agreement to have surgery, we're now a team, and we're a team, good or bad. So it's important to have that confidence in your caregiver and really feel like that person is connecting with you, so that when the good things happen, great. But when the bad things happen, you know that somebody's got your back, okay? We may not be able to fix everything, but we'll do everything we can to try, okay? So let me see, anything else? Big things with regard to spine and risk. Oh, a lot of people ask me they're afraid about, particularly older patients, about dying with surgery. having a heart attack, having a stroke, something like that. Actually, these days, and that's really an anesthesia problem. Anesthesia is super safe. We operate on people in their 80s, 90s, and even hundreds very commonly. So just because you're X age doesn't necessarily mean that surgery is not an option for you. Now, aging, medical problems, medicines that you're on, allergies that you have, these types of things do increase the chance or change the dynamic of risk, depending on what it is, but it doesn't necessarily keep you from having a safe, successful operation. So don't let that alone deter you from trying to seek improvement, okay? Again, it's a balance. It's a risk-benefit ratio. It's how much can I get from this? How little benefit might I see? And how much risk there is to me as far as having a harmful problem happen. And that's a conversation that you got to have with your doctor. You got to have it with yourself too. You also have to have it with your family and friends, because there's a lot of times when we see patients, have people talking in their ear about this and this and this, but it's the patient that has to make the decision. So talk to them, understand their concerns, get the information from your doctor so you can make a decision for yourself. Don't let anybody else talk you into anything, okay? So again, risks, complications do happen. Bad outcomes do happen. There's never 100% guarantee on anything we do, whether it's function relief, pain relief, getting back to the level of activity that you're at. We cannot make guarantees like that. There are odds, and it's likely that we can get you here or there or get you this benefit. But just remember that we're taking something that's broken, out of place, deteriorated, and trying to improve it. We're not taking you and giving you a new, brand new out of the box, unwrap it, put it back in, body. Even the word joint replacement, I always have had a problem with that, because it's not truly a replacement, it's a substitute. It's a man-made device that's meant to substitute for what you were born with, okay? It's never going to be 100% perfect. It can get pretty close, but it's not going to be perfect. And it's unrealistic to look for pain-free and perfect. 100% pain-free. And what I mean by that is I want to be normal, pain-free, not having to think about it. Life doesn't work that way. Most surgeries can get you close, but we can't guarantee pain-free and perfect. So as long as you understand that, we can really do a lot to improve your lifestyle, okay? So that's kind of the end of the story today. I don't want to depress you too much. Take this as you will. Like I said from the beginning, these are all topics we talk about in all of our practices, even though I may not do hand surgery. The hand surgeons have their own set of conversations with patients about risk and potential downsides and whatnot. Most of them are kind of universal. Some of them are specific to various body parts or certain procedures. But the only kind of difference in spine surgery rather than much of the musculoskeletal type of work is in most of those cases, they can't cause somebody to be paralyzed. That's my area of work. I can potentially cause you to be paralyzed, and we talk about that. I can potentially cause you permanent nerve damage, and we can talk about that. But there are other structures that can be damaged as well. So just be thoughtful of that. Don't be scared about it. Just be thoughtful of it. It's the conversation you need to have. Embrace the conversation. Be wary of people who don't have this type of conversation with you. Okay? If you're somewhere else and they've talked about, we'll take care of your knee problem, there won't be any sweat, you'll be as good as new, we'll sign you up, see you later, bye. The hair on the back of your neck should stand up a little bit. Well, what can happen, what can be bad? Listen to that, okay? We'll do everything we can in our power to help you understand and navigate through your care to get the best outcome we can get. Okay? Anyway, so that's it for today. So next Friday, we're going to meet with Dr. Keith Douglas. I don't think we've had Dr. Douglas on this show. He's a hand specialist, so he deals basically everything from the elbow down. We haven't decided on a topic yet, but it should be pretty interesting because the hand, well, we did talk to one hand surgeon. We talked to Dr. Brown. So we talked a little bit with her a number of months ago, but Dr. Douglas is here in the One City office. He also sees patients in Mount Juliet, I believe, and Cookeville, so he's kind of around. He's been around a long time. He's a good doctor. He's a good guy, and I look forward to talking to him. So that'll be next Friday at noon, same bat time, same bat channel, okay? For those people who know what I'm talking about, you might laugh. For those who are too young, as our conversation before, they didn't know who my favorite Martian is, okay? That means I'm old. Anyway, thanks for allowing me that. Again, TOA.com, that's your resource for musculoskeletal care in Middle Tennessee. Learn about what we do, learn about our practices, make an appointment online. Go to the Media Center and learn about musculoskeletal health and care. Anyway, that's it for today. I hope you guys had lots of hot dogs last weekend. I did. It's the only time I eat hot dogs is 4th of July. Go out, get vaccinated, okay? The people who are in the hospital sick as stink and dying, the majority of them now have not been vaccinated. There's very few people who are getting sick enough to go to the hospital that have been vaccinated, okay? So I understand there's concern, there's risk, there's unknowing about everything. But at this point, the science points to vaccination is the best way to keep you from getting sick enough to have to go in the hospital or dying from COVID. So think about it. Anyway, we'll see you next week. Thanks. Appreciate you. Sorry to depress you. It's not really depressing. It's just information. Go out there, live your best life. We'll see you next week.